Glad to have you here, Ariel. How are you doing today?
I'm great. Thanks for having me.
Of course. Thank you again so much for being here. We've talked to a lot of nurses on the show so far, and it's just very interesting to hear, their perspectives of how things are going. And I think you share a really interesting perspective because you know, are a relatively new nurse. Like you started during the pandemic, and I think that itself has thrown a whole nother layer on being a nurse and the challenges with that. But I think we can just start like taking it all the way back. How did you begin your nursing journey, and how did you decide that that was the path that you wanted to go through?
Yeah, so am my background is pretty unconventional. I earned my first bachelor's degree in hospitality management, and I worked in the restaurant industry for about 5 years prior to becoming a nurse. And what made me want to go into healthcare was a personal experience, which I think a lot of nurses, especially second degree nurses, have. I'm very close to my grandparents. They raised me growing up. And when they started to get older and they got sick, I was one of their main support persons. When my grandpa was in and out of the hospital, in and out of nursing homes and long term acute care hospitals, I was always there beside him. I was always there when he was in the ED, um, right alongside with my grandma, who also got sick along the way. She was getting old too, and she couldn't care for him the way that she would have wanted to if she were younger. So, my, I guess my introduction to the world of medicine and healthcare kind of began then. And from my different experiences being there for my grandparents, my interactions with physicians and nurses and nurse practitioners and different healthcare settings, that kind of made me question whether I could see myself working in that world and whether I felt like I had something to add to the world of healthcare. And I felt like I did. So I started to explore the different roles. I mean, I think one of the first roles a lot of folks who think about making a career switch into healthcare think of is, do I want to become a doctor? And that was something that I ruled out relatively early in my decision making process. And I think the reason why nursing appealed to me was because of the amount of time that nurses who were taking care of my grandparents spent with me, and the amount of time that they made such impactful impressions on me as somebody who wasn't in healthcare. And the at the end of the day, when I asked myself who I felt was there for the patient, there for the family the most, it was the nurse. And that's what kind of helped me make my decision as far as what I wanted to do in healthcare.
Right. Kind of the long-term patient relationships was something that you valued a lot.
Yeah, and you know it's people say this all the time about nurses, but who spends the most time with patients, who spends the most time with families, who knows the patient the best. And it is often the nurse because of just the sheer amount of time that we spend with our patients and with their families, just because of the nature of the work. I'm not saying that, physicians and PAs and NPs don't know the patient, but
Mhm.
there's a different level of familiarity and I think intimacy that nurses have with their patients.
Right. And I think like you were saying, like especially in terms of like if you're seeing a patient over a long time, I think that the interesting thing that you're seeing is like you get to know that patient more than just their patient life. Like you get to really dig into, what they find interesting, and that's something that I find really interesting about healthcare because it's not all about, treating your patient with, the medications or with, that kind of things. It's about also being that kind of mental and emotional support where you are kind of responsible to know like the things that they enjoy, the things that they like talking about, and I think that's a really interesting aspect that you get as a nurse.
Yeah, absolutely. When when I was early in my decision-making process and trying to figure out what in healthcare I wanted to do, I
Mhm.
looked up I just Googled difference between nursing and between nurses and doctors. And one of the first things, I think, because I originally I entered nursing school with the intention of leaving with my master's to be a nurse practitioner. And one of the first things that someone Googles is the difference between nurse practitioners and physicians. And the textbook answer has always been the medical model often focuses on pathology, and the nursing model focuses on the patient as a whole. And I think it's that's, like I said, a textbook answer,
Mhm.
and I think it makes it very black and white, but I don't think that the reality of the difference between nursing and medicine is that way because my husband is a physician and he was trained in the DO model, which absolutely looks at patients as a whole picture in a holistic way. And not that MDs don't either, but I just after becoming a nurse, I felt like that was a very incomplete and black and white way of thinking about it. But on the other hand, in nursing school, I did feel like there was such a large emphasis on treating the patient as a person and
Mhm.
the all of the intersectional ways that make this person who they are. And it doesn't we have to absolutely treat the pathology, and the lab values are important. All the numbers are important, but just as important is the person.
Right.
And I think that nurses are very strong in being able to care for their patients in that way. An
Right.
example that I have is a very recent example. I'm a new nurse, as we've discussed, and I work in an ICU, specifically a COVID ICU. And you know, with COVID patients, the number one thing is often respiratory related because COVID is a respiratory virus. And so, normally, if a person's O2 level dips below 92%, that's when we, intervene with some sort of oxygen therapy. Um, we're finding that with COVID patients, they will often desaturate to levels of 86, 88%, but they don't look like they're in respiratory distress. So the threshold to intervene with more aggressive interventions is a little bit lower now with COVID patients.
Mhm.
And so an example I have is a COVID patient I had where their oxygen level was, 88%. So a lot of
Mhm.
the medicine team that I work with, um, they're often not inclined to intervene unless the patient is in distress. Like they're saying that
Right.
they can't breathe, or they're tachypnic, which means that they're breathing really quickly. Um, and so the resident I was working with, saw the numbers, just looked at the numbers on the screen and said, they're satting 88%, they're mentating well. We're not going to intervene. But as the nurse who has gone into the room several times,
Right.
this person might be mentating. They might be able to tell you who they are and where they are. But if you just look at the person, he, the patient looks uncomfortable. The patient does not look like they don't need help, And so one of the things that I often say to the residents or the providers is look at the patient. How do they look to you? Don't look at the computer, don't look at the numbers. How do they look to you? Because that is just as important of an indicator of whether or not we need to intervene as the numbers are.
Right. That's really eye-opening because l- it's interesting to see like those numbers. And I was actually talking to a physician recently who's been practicing for over 30 years, and he really talked about this point where like there's been such an advent of like testing and all these procedures that have come out, in the last couple of years that have, given you positive, negative results, showing you something or not showing you something, where he felt like the examination aspect of the visit was not valued as much as those test results. And so he expressed concern in that, and you're saying a very similar thing, and I think that's really interesting to think about, in the sense of you're just looking at the numbers instead of looking at the patient as a whole. In terms of education though, like while you're going through nursing school, how does the nursing program emphasize or emphasize this value of looking at the patient in particular, and looking at them as a whole like that?
Yeah, I think one of the first things that comes to mind for me is um, dietary habits, which I think is something that oftentimes is oversimplified in terms of when we instruct patients on what to do, when we instruct them to eat healthy, when we instruct them to get more physical exercise. It's really easy to prescribe that because I mean, I think most adults in America could be eating healthier and, could be exercising more. There's no denying that. But without addressing the barriers to how a person for why a person might not be eating healthy or for why they aren't exercising, I think is just as important. Because if my patient is, you know, a custodial worker who works um, 8 to 10 hours a day, who, you know, has 3 children to feed, who from his work as a custodial worker does not make that much in
Yeah.
terms of, his monthly salary. And if the decision for him, the dilemma is, am I going to work more so that I can make more money to provide for my family, which might mean that I don't have enough time to cook, to go grocery shopping, to go exercising. Um, if that's a decision that my patient has to make, oftentimes they just simply can't find the time to go grocery shopping and to learn how to cook, or to pay for a gym membership, or to
Right.
find the time to go running, or things like that. Those barriers are very important to discuss, and if we don't address that, we're just going to be handing out these suggestions for our patients without any real way to help them achieve these goals. And I think that's one of the things that I learned in nursing school in terms of approaching the patient as a whole person.
Right. And in those situations, because you bring up a really, I think, common case too, like, I've shadowed family medicine doctors all the time, and what you said was exactly what I hear, physicians telling the patients, like, you need to get more exercise, you need to, make these lifestyle changes, and you just see like a nodding by the patient. But like when you really think about it, are they really doing those? When they're back home, are they really following through with those? Are they even able to? Um, and so, what as a nurse, what kind of, I guess, workarounds do you see for patients that are unable to do those things?
I think number one, like I said, is identifying those barriers, and number two is having an actual dialogue with the patients to see what they feel is attainable and what they feel is realistic. And oftentimes, social work, use if you have the luxury of having a social worker, in the system that you work in, involving them is very, very helpful. Number two is just coming up with like baby steps and coming up with a plan that, we might not be able to change this person's diet
Mhm.
over the course of days or weeks, but helping them formulate a plan to achieve this in baby steps is something that nurses are often able to do because we're able to spend more time with the patients. But it's all about, I feel, having a dialogue with the patient, meeting them where they are, and being there to help them come up with a plan to live a healthier life, to make these lifestyle changes.
Right. Something that's like actually like plausible, and something
Hmm.
they can follow through to. Gotcha. Kind of moving towards your practice as a nurse. And 2020 has been a big learning year for everybody, but for you in particular, you've had, I bet, quite the experiences, starting work as a nurse, in the middle of pandemic. So just talk me through, I guess, like how has that experience been?
It's been overwhelming
Yeah.
in one if I could describe it in one word, it's been overwhelming. Um, I'm told all the time by my coworkers that if they started their nursing career in the middle of a pandemic, in the ICU, they probably would have walked out. I was told that the other night when I was at work. And I think one of the things that has struck me the most is the way that we interact with death in the ICU, especially in the COVID ICU. Um, and I don't think it's just with the COVID ICU. And what I mean is, I've like written about this and talked about this on my
Hmm.
platform before, just because of how much it's been impacting me. But you know, death and the ICU has always gone hand in hand. And learning how to deal with patient death is something that I knew that I had to prepare myself for if I were to work in critical care. But the way that COVID has changed that is that oftentimes our patients die alone. Um, they die with their family members on FaceTime, with the nurse holding the phone or the iPad up to their face so that their family can say goodbye. And that is not something that I was prepared for. Um, it's, I think that has been one of the most difficult parts of COVID, in the ICU. And it's, I don't know, it's
Yes.
just, it's not something that I
Yeah.
can't say enough I wasn't
Because
prepared for.
yeah, right. Because like, how do you even prepare for that without having the experience for it? Like, it just seems so difficult, especially when you're coming from a place where you don't have years of working as a nurse, seeing the occasional death here and there, and then all of a sudden you're seeing it like almost like on a daily basis,
Mhm.
or and more recently even more. And I think it's a really important dialogue to have, because the case numbers, we look a lot at the numbers, right? And then we're seeing like, oh, the death toll is this high, this many people are dying. But then I find it really interesting that, health professionals like yourself are seeing those numbers in person, and you're seeing who the people are behind those numbers.
And how they're
That
dying.
exactly of how they're dying. And one of the things that I dislike about the media is, or mainstream media, is the fact that, you're not hearing enough of stories from yourself, talking about how really gruesome and how like sad it really is for seeing all these people having to say goodbye to their family members on FaceTime. And I don't know, I think it's just a hard topic to talk about.
Yeah, absolutely. I think it is. And it's, I don't think that, and the thing is with critical care, especially because I work in a MICU, which is a medical ICU, death is not always seen as a negative thing, especially in MICUs. Oftentimes, MICU providers and MICU nurses see death as something that is like a relief. It's an end of suffering. It's the end of, all these heroic interventions to save a person who might not have a very high quality of life if they were to survive. End of life discussions and goals of care discussions are kind of like the specialty of the medical ICU. And oftentimes we don't see death as a bad thing. But, that's with that's a death without COVID, where we're able to provide all these comforts, and, we're able to organize and schedule these visits with family members so that they can
Mhm.
be there, they can hold their family member's hand. They have closure in being able to see that their family member is at peace. Um, and just the closure of seeing a person, seeing a family member go and seeing them die and knowing that they're at peace in person is a type of closure that so many family members don't get right now. It's family members aren't even able to, they're not able to be in the hospital, they're not even able to be in the room when somebody dies. They just hear from us that they're gone, from a complete stranger, or to see on FaceTime. I can't imagine, it's traumatizing enough for healthcare workers, but I can't imagine how traumatizing that is for the family members.
Right.
And that's one of the ways that COVID has changed healthcare right now.
Yeah. I completely agree. It just, because like I can relate to that. Like, I back, my family's back in India. There it's been pretty crazy, and
Mhm.
especially earlier on, And one of my family members, we actually were on FaceTime with them in the last moments, and it was just like, this shouldn't be how it's like. And it was at a point where, flight or air travel was not like, it was very restricted and things weren't allowed. So the fact that we're not even able to go, see this person, or even, do any of the progressions or anything that is required, and just have to watch it all virtually, it's insane. And having, someone like seeing it, like you're seeing it every single day, must be like um, a whole nother aspect of that. I don't want to talk about death too much, but it
Oh
really
yeah.
is. Yeah, it really
It's
is.
it's unfortunately
Yeah,
it's just such a big part of
it is.
healthcare and part of my work right now,
Yeah, especially
unfortunately.
right now. Yeah, exactly. Right now is
Hmm.
just, I don't know. And I keep saying I don't want to talk about it, but like one thing that really, aggravates me a lot is the fact that people, deny, the thing that aggravates me the most is that people deny the existence of the pandemic after all these cases, and these people that have seen countless lives being lost to it. And it just I don't know what to do about it. Is there anything to do about it? I don't know, but
I don't know either.
yeah.
I've had people in the ICU who are pandemic deniers,
Really?
who are in the ICU, or they are anti-maskers, or just don't believe in COVID, quote unquote.
And they're
And
in the
it's
ICU.
yeah, yeah. You can't make this up. Like I've only personally met one of them, but I mean,
Yeah,
I'm sure nurses all over the country have had that experience.
right. And I kind of want to talk to you about something that was really big earlier on in the pandemic, and I want to hear your experiences on how it's, progressed. But, as an Asian American, especially in the beginning, there was a large stigma against like Asian Americans, and the fact that the pandemic was, originated in China, had a big impact on a lot of Asian Americans, and there were videos and things going viral on social media of Asian Americans being, hurt physically in public places, and all that kind of stuff. And I think you've done a lot of outreach and a lot of advocacy in that regard. And I just want to hear from you what your experiences were, I guess, in the beginning, and how it's changed throughout, the pandemic.
Yeah, I I've had very personal experiences with this because in the beginning of the pandemic, so I started working as an ICU nurse in September, but
Hmm.
I was helping with the Pennsylvania Department of Health's response to COVID starting in March. So I was doing COVID tests for a few months, and I I was reading and hearing about, this anti-Asian bias that was happening around the country, but it didn't really impact me until there was one day where it was back in March, but I had woken up one morning after a day of testing, and I was walking my dog, and there was a man across the street from me who saw me and just started screaming racial slurs at me. And,
Wow.
I and saying something about the virus. And I didn't really hear everything he said. I just in that moment I was just like, I need to get out of here. So as a healthcare worker, as an Asian American healthcare worker, it just seems so ironic that anti-Asian bias was manifesting in that way, and impacting me in that way. um, because it really opened my eyes more to the the level and the strength of anti-Asian bias and racism in this country that continues to exist. Because,
Right.
you know, I think a way that racism is unique to the Asian American community is that we continue to be seen as the perpetual foreigner, um, no matter what. I mean, I was born in this country. I the first thing that someone sees when they see me is an Asian face, and the automatic assumption is that I'm not from here, or
Mhm.
that you know it's I think it's racism impacts different communities of color very differently, and I think this is one of the ways that racism uniquely impacts Asian Americans. Um, and it just shows that, you know, anti-Asian bias is not new in this country. It's it's been here since the beginning of, since the from the
Mhm.
beginning when Chinese laborers came to build railroads in this
Right.
country. And it's always kind of been the same, that we're seen as these foreigners that don't belong. And no matter how successful we are in this country, no matter how, all the accomplishments that members of the Asian American community achieve, we still continue to be seen as foreigners and as scapegoats for attacks. Um, and that is something that, I talk about a lot on my platform, and I I discuss because I personally grew up in a predominantly Asian American community, and I was very much sheltered from this racism because I was surrounded by people who looked like me.
Mm.
Um, but then, moving to Philadelphia and being actually feeling like a minority, because Asian Americans are only 5% of the population in the US, it's been very eye opening.
Right. And talking about your platform in general, like I'm sure um you've done really amazing things, and like you said, you've done a lot of work with fighting this anti-Asian American bias. And one thing that always is concerning to me on social media is the fact that people feel more free to say whatever they want, in the sense that they're more free to be mean and be very like say things that they wouldn't say in person, basically. And through your platform and through the people that you're reaching, you've done a lot of good. And have you had experiences where there are people that are just blatantly being like disrespectful, against you on your platform and things like that?
Oh, definitely. Not in the sense, I don't know if I've experienced necessarily um, anti-Asian racism, which I'm a little bit surprised at actually. Um, there was like, I remember I've definitely experienced microaggressions. Like I think I wrote about that incident where that man was yelling,
Mhm.
racial slurs at me. And I think a woman commented, well, what if you just wear sunglasses outside? Then maybe
What?
they won't know that you're Asian. And it's like, I think
That's just,
it's it's I
that's
mean,
not the problem. Like,
micro microaggressions like that
yeah,
are what I experience. It's more of an issue of maybe not being a racist rather than me hiding the fact that I'm an Asian
yeah.
American. But I think I think the backlash, or these incidents of folks being disrespectful, have actually been more related to my advocacy for the Black community,
Mm.
than it has been as an Asian person. I think I've actually experienced more pushback from other Asians or other Asian Americans, when I discuss, my support for the Black community, than anything else.
Mm. And is that kind of coming from a sense where like you're supporting that movement like instead of like I'm trying like
Yeah,
yeah.
yeah, I think so, and I think it's it points to how, you know I've written about this before, but
Hmm.
I think a lot of people see justice and equity as like a piece of cake, where if this
Hmm.
community has it, then we get less of it. And I think that's just a tool that white supremacy uses to further divide communities of color. And
Right.
I mean, talk about the model minority myth. That's like textbook example of how often communities of color are pitted against each other, where you know white supremacists will hold up Asian Americans as this example of the model minority. If Asian Americans can be successful in this country, then racism must not exist. And then so that implies that there's something wrong with the communities of color, specifically Black and oftentimes Latinx and Native American communities who struggle in this company in this country. That there's something wrong with you if you can't be successful. If Asian Americans can be successful, and unfortunately, I think a lot of Asian Americans buy into that, and buy into that narrative that my family worked hard, and my parents came here with nothing,
Mm,
and look at how successful they are. So, why are you advocating for this community? And I think there's a lot of work to be done in the Asian American
right.
community to fight back against that.
Right, and that's it's a really interesting point that you bring up because you've probably heard of them, but Wong Fu Productions. Have you heard of that?
Mhm.
Like, yeah, so they're one of my favorite, video production.
They were made in this SGV, my hometown, which I'm very proud to
Oh,
be from.
yeah, no,
Yeah,
they're amazing, and they
I love Wong
actually,
Fu.
yeah, they I've been watching them for the last, I don't know, like at least like 7 years or something, and they
Hmm.
deserve way more views and such than they get, and
Oh yeah,
that's a whole
they're
nother story.
amazing.
Yeah,
Hmm.
but they made this one, and you've probably seen it, but they made this one short film about it was like it was Asian Americans, two, like a brother and a sister and their, I think, father at a dinner table. And so the daughter was like, I'm going out to the march. I want to, like, it was during like Black Lives Matter, like a lot of the marches were occurring during this time. And she was like, I want to go out to the march, support the movement. And then her father was like, why are you going out? Like, you don't want, it's not safe. Why are you going out for that? And the whole, I guess, moral of the story was the idea of like, you need to, all people of color are in similar situations, and you need to be able to support other causes if you want to support your own cause. And that's really interesting because I think that's the future that we're hopefully going to move towards, where it's everyone of course has their own issues, but you have to advocate for each other's issues in order to get your own issues out, and and solved.
Mhm. Yeah, I mean, that was one of my I was on a panel to discuss anti-Asian bias in the US. I think it was a few months ago, but it included notable Asian Americans such as George Takei, Tai Ma, who's an actor, Dion Lim, who's a journalist in San
Mm,
Francisco, um, and I when I was preparing for the panel, which was hosted on Zoom, I kept telling myself, if I'm going to say one thing, it's that Asian Americans need to be supportive of the Black community and the Black Lives Matter movement. If if we are asking for allies against this anti-Asian bias, we need to be allies as well to our brothers and sisters. And that I was like, if there's one thing I'm gonna say
yeah.
on this, that's what I feel like I have to say because
Right.
you know I just felt like all all the Asian Americans that I saw, that I met, who were so fired up about this, you know, anti-Asian bias and this hate towards Asian Americans when they were speaking up about this, if you don't fight for another community, I just felt like it was so hypocritical. And the same force that is, perpetuating this violence, both physical and verbal, against Asian Americans is the same violence that is killing Black men and women and children in this country. And that force is white supremacy. And it's not, white supremacy is not just manifested in, racial slurs, which I think is like one of the most extreme forms of it. Violence and hate speech is on one end of it, and the other end of it is microaggressions, and it's the same spectrum, that but it impacts different communities differently. And I felt like that was something that I feel very passionate about in discussing and educating my audience about in on Instagram.
Right. And I have a question for you about that. With regards to social media, this last year, I know in particular, social media, especially with everyone, being at home quarantining and trying, not to go out too much, has been a very big force of advocacy for Black Lives Matter, for social justice in general, and of course it always has, but there was a period of time, and even now, where like it's the majority of the things that you're seeing are these topics. So as an influencer like yourself, and someone who does social justice and has been doing it on their platform for a very long time, how have your experiences been, doing that?
It's been overall very positive for me, and I think it's because I've met a lot of really great people on this platform. Um, as somebody who got married relatively early and has not dated that many people, I kind of look at it as like my online dating experience, but platonically because I'm
Hmm.
meeting so many different people and I'm building like actual friendships and relationships with these folks. And it's been such a great experience in that sense because I feel like I've made so many friends on Instagram, people that I would have never met otherwise because of distance, because of, other barriers. But overall, it's been such a great experience meeting other people who, feel as passionately and strongly about the things that I'm passionate about. Especially because a lot of them are healthcare workers and they're people of color, and I just feel like a sense of solidarity in meeting these folks and being able to talk with them and get to know them on a level other than just, social justice. But I think that's been the overall my overall experience with social media.
Right.
There's always going to be people that um, who are, trolls, or they try
Right.
to um, diminish your my work or my efforts to, you know, bring conversations about race and social justice to the forefront, especially for the Asian American community, because I think historically, especially as someone who grew up where I didn't see many Asian Americans speaking out about these things, and that's something that I want to change. But it's been overall a fantastic experience.
Right. And in terms of like for you, everyone has their own goals with their platforms, but what are your goals that you hope to accomplish through your platform?
I think, like I said, one of the first things is, normalizing these traditionally
Mhm.
taboo conversations, and not just about race, but um, race is one of the most important things right now. But as an Asian American woman, you know, discussions about sex positivity and, mental health, things like that. I want to I want to normalize conversations like this, and I want to see more Asian American women, you know, talking about these things on social media to normalize it for, young Asian American women and young Asian American children who might be on this platform. And I think that's one of the most important things. But also, I think I lost my train of thought.
Yeah, no, you're
What
fine.
was the other thing I was going to
And a
say?
really interesting thing though, like, because I usually ask this question to everyone, what are your ultimate goals and things? And the thing about social media that is really interesting is that it's very unpredictable. You never know
Mm,
when you're gonna pique an interest in a particular thing, or you're going to, dive deeper into something that you might have not have even been interested in before. And so things change so easily that even after you set goals, like, you can end up being somewhere else, and wanting to spread other things. But I really like what you're talking about, because being uh, you know Indian, and being in that area, in that upbringing, I relate to a lot of the things in the sense of, like, mental health and things like that that need to be
mm.
spoken up more about in communities like ours. And so that is, I think, a very valuable thing, and very empowering. And that's the thing I love about, social media, is the fact that you're able to do that in wherever you are in the world. You're able to see these things wherever you are, and it really has the ultimate reach.
Yeah. I think one of the first things that comes to mind is, um, are you part of the Facebook group Subtle Asian Traits?
I am. I love it.
I love subtle Asian traits, and I
Yeah.
think that's another kind of goal that I have for my platform, inspired by subtle Asian traits, is to make Asian Americans feel seen, um, and to feel like a connection, or that that moment of joy when you're like, "Oh my gosh, that's so true." Like
Yeah,
when
yeah, yeah,
we
when
talk
you
about,
relate to something.
upbringing.
Yeah.
Yeah, and I think that's something that I want to incorporate into my platform as well. The most important things to me to discuss are racism, sexism, things, those important issues. But I incorporate a lot of, I feel, content that I want to cater towards the Asian American community
Mhm.
because I want Asian Americans to feel seen and like it's a safe space for them basically. Um, and so I talk all the time about, you know, how um, y- experiences growing up as an Asian American,
Mhm.
both the traumatic parts of growing up
Mhm.
as the child of an immigrant, but also the really funny parts of it.
Yeah.
And oftentimes the traumatic and the funny often intersect. Um, but yeah, I think that's another goal of mine on social media.
Awesome. And in terms of your practice in general, do you have any goals in terms of what you want to do with nursing? Do you want to, specialize into any particular type of nursing or anything like that?
Um, you know, with nursing, I don't know how long I can see myself working as a bedside nurse. And maybe it's because I've started in the middle of a pandemic in critical care,
Mhm.
and maybe it'll be different, after the pandemic has passed. But along related to the passion and the importance that I feel for movements such as social justice, I have always imagined myself in working in some sense in public service, um, whether that be in an elected official position or not. I think policy and advocacy has been something that I've always been very interested in. So I can see myself working clinically it, for the near future because I do love nursing and I want
Mhm.
to grow my skills as a nurse. But something that I've always considered is how else can I help people, and maybe that might be in advocacy or policy. So I don't know.
Right. Yeah, and you don't need to know right now. I mean, it's wherever it
No,
goes. Yeah.
no, having a plan is so overrated, and that's something
Yeah.
that I have had to really allow myself to just kind of let go
Yeah.
because have you heard of Myers-Briggs?
Yeah, the personality test?
The personality test.
Yeah.
I I don't like categorizing myself or
Mhm.
categorizing other people, but when I found out about Myers-Briggs, I was so intrigued, and I took the test and I'm an INTJ. So I like lists and I like having goals and like I like having things going according to plan, but I've been working on that because that oftentimes leads me to disappointment. And
Mhm.
when things don't go according to plan, which
Yeah.
is life in general, it can often feel like catastrophic.
Yeah.
But I, I'm working on not being so rigid.
Right. And I think like it's another thing you bring up about like the upbringing part. Like, that's part of
Oh yeah,
how it's very
definitely.
tied into that. We were raised to have a plan and to really go into something that, has a clear future in wherever we're
Mhm.
going. So, yeah,
Yeah.
I think it's
I mean, we can probably find like 200 memes on subtle Asian traits about
yeah,
that.
exactly. Yeah, and I've definitely seen a bunch. But I don't want to keep you too long, but I'd love to hear in your time practicing, what have been or what has been a story or an anecdote, it could be whatever, but something that you've held really close to yourself and something that you think of often.
Oh, that's an easy question. During nursing school, I cared for a actually, which story do I want to tell? Let me think.
You tell both or all of them.
Mm, Well, I think it's felt very special for me when I'm able to care for an Asian or an Asian American patient because especially if they're Cantonese speaking, because that's my family background. And it oftentimes, patients that I meet are older. And so if they're Asian and they're older and they speak Cantonese, I'm like, oh my gosh, I'm taking care of my grandma or I'm taking care of my grandpa. And my I remember this patient that I had when I was in nursing school, and she was a cardiac surgery patient, and, you know, I took care of her around Chinese New Year time, and so sh as the matriarch of her family, she's normally around Chinese New Year cooking up a feast for her family, but, this time she was in the hospital and she seemed depressed, and I one of the things I did for her was, bring some Chinese food. I cleared it with the team. They said it was okay. I brought her some Chinese food the next time I was in the hospital, and, um, it was just such a nice experience to be able to connect with a patient that way in a setting where she felt very alone. Um, and she spoke English, and I don't think she spoke Cantonese, but she we were just chatting as I was taking care of her, and you know one of the things that I'll never forget is, at the end of my time taking care of her, she like took my hand and she was like, you're your parents' American dream. And it made me want to cry
Aw,
because it's just as an affection deprived Chinese kid who never got affection,
yeah.
growing up as a kid, that was just so because I knew that it was true. I knew that, me being educated in the United States, going to an Ivy League school and, achieving all these things that my family just dreamt of and worked so hard to help me achieve it really just hit me in the feels and I
Aw,
like cried when I got home. But I hold on to that all the time. I think about that patient all the time. And most recently caring for a COVID positive critical care patient who was older and spoke Cantonese, and unfortunately they didn't survive, but it just felt so special being able to take care of this person, and being able to interact with the family, um, especially as a Cantonese speaking nurse. So things like that. If you're old and you're Asian and you speak
mm,
Cantonese, you're automatically gonna get like just
yeah,
cemented into my heart as a nurse.
that's awesome. And I'm sure they appreciated that beyond like that could be known. And that's the thing about medicine that I think is really interesting is this idea of the face of medicine really changing, and
Mhm,
it's exciting to see. And I think through social media you're able to see it much more clearer because you're seeing doctors from all backgrounds with their platforms, and to
mhm,
see that all these doctors are practicing right now is just a really good feeling that we're going in the right direction towards where we need to go in medicine.
mhm. Yeah, and I think healthcare providers, it's rare that you have these interactions where, a patient expresses gratitude to your face or like a family
Yeah.
member expresses gratitude to your face. It often doesn't happen because things happen so quickly in the hospital and you go from the ICU to a step down and you never see that provider again. And I think, you know, something that I want to pass on to future healthcare workers is that you never know the impact that you have on a patient, whether it's positive or negative. And I think that's part of our responsibility to be, knowledgeable about the social determinants of health, to be empathetic and to listen to our patients when we care for them because we never know how it's going to impact them. And I think all of our as healthcare workers, we all have the goal to positively impact our patients. And I think that that's one of the driving forces for me as a nurse. I always want to impact my patients positively. And so that's why I'm passionate about educating myself as a non-Black person of color about, the barriers that Black and Brown patients face, and being more educated about that and being more educated about the barriers that my own community faces in healthcare. And it's not there are barriers that, white patients face as well. And these are all things that I'm trying to learn, that I'm trying to incorporate into my nursing practice.
Right. And that I really like what you just said. Like that, I think that is the most important thing to know when you're dealing with patients, because you need to know what are the, like you said earlier, the whole patient. But Ariel, thank you so much for talking to me today on the podcast. I really appreciate all your insight, and it's been really fun talking with you.
No, thank you so much for having me. This was so fun.
Yeah, of course. Yeah, do you have anything else you want to just add?
If there are any young future healthcare workers out there listening to this, you can do it. It's really hard. Especially, I mean, my personal experience is nursing school. There were so many times in nursing school when I cried, even before I entered nursing school, when I was like, I don't know if I can do this. But, the road is hard, but it's worth it. And if we can see more people of color in healthcare, that's something that I would love to see in the future. So if you're listening, you can do it. I'm there to help you if you need. You can find me on Instagram, but I'm mentoring is something that I'm very passionate about as well.
Gotcha. And yeah, thank you so much because yeah, I'm not yet on my medical journey. Like I'm about to apply to medical school now, and
It's
so
so exciting.
yeah, I'm gonna need all the good vibes there are. So again, thank you so much. I hope you enjoyed listening to our conversation, and thank you so much for listening. If you love Perspectives, be sure to follow us on Spotify, drop us a review on Apple Podcasts, and share this podcast with your friends. It really helps us grow, and I'd really appreciate it. Thank you so much, and I'll see you next Monday.